Thank you, Rhonda, and welcome everyone. Welcome to this month's Policy Crunch. I'm Jeff Kinder. I'm the Executive Director for Science and Innovation here at the Institute on Governance, and your host tonight for Policy Crunch. So this month we are looking at the issue of distraction or disruption, a conversation about the impact of COVID-19 on the overdose crisis in Canada. So obviously over the last 9 months, most of the public health discussion has been about the pandemic, but that doesn't mean that other issues have disappeared. And so I'm very excited to be exploring this issue tonight with you. And we've got a stellar lineup of panelists that Rhonda will introduce in just a few minutes. Before I go further, however, I would like to acknowledge that those of us in Ottawa are convening on the traditional and unceded territory of the Algonquin Anishinaabe people. We have a number of people joining us tonight that are first-time policy crunchers. Let's see if we fix that feedback. So because there so many are new, I want to take just a minute to explain our format tonight. In just a couple minutes, I will be throwing it over to Rhonda Moore, who will serve as our moderator. She will introduce our three panelists. They will each then speak in turn, give some opening remarks for 5 minutes or so each. We then will open it up. Rhonda may have a few initial questions, but then we will open it up for a general Q&A with all of you. If you're joining us in the Zoom, you can obviously put your questions into the chat. We also have Slack where you could put questions into the chat, or you can use our Twitter hashtag PolicyCrunch. We'll do that up until the top of the hour at 7 p.m. Ottawa time, at which point we will put up one final poll to get your feedback on the event. We always are very interested to hear your views. And then we will bring to a close the formal portion of the evening. However, if you are interested and you're joining us in Zoom, you can remain, and we will put each of the three panelists into a breakout room. And you can indicate via the chat who you'd like to go meet with. This provides an opportunity, for example, if you had a question that you weren't able to get answered during the plenary part of the session, we'll stick around for 15 or 20 minutes in breakout rooms and allow you to ask questions or just engage in conversation with each of our speakers. And like I said, we'll draw it to a close typically around 20 after 7. And with that, I believe we're good to go. So Rhonda Moore is my colleague here at the IOG. She's the practice lead for science and innovation, and she will be serving as our moderator tonight. So Rhonda, over to you.
Thanks, Jeff, and good evening, everyone. I have kind of two things that I'd like to do before I hand it over to our panelists. I'd like to set the stage with some facts for this conversation, and then of course I will introduce our three panelists. They'll each speak for 5 or 6 minutes, and then as Jeff said, we'll have a Q&A, and you're invited to submit your questions in the Zoom chat, on Twitter, and on Slack. So first, maybe some facts about the situation, or to set the stage for this conversation. Tonight's panel is a very different one from some of the more theoretical conversations that we have hosted at IOG in the past. Tonight, our guests are three people who live and work at the front line of this issue. Each one wears many hats: student, professor, producer, podcast host, harm reduction worker, drug user, policy thinker, and advocate. Our conversation this evening will explore the overdose crisis in Canada from a few different lenses. We'll discuss the significant stigma and bias that surrounds drug use, how the COVID-19 pandemic has exacerbated the crisis, and we'll talk about some solutions. To get us started, I have collected some facts for us. First is Canada is in the midst of an overdose crisis. Health Canada collects data on deaths by overdose each quarter. They maintain an interactive map, and there's a link to that map in the chat for you to view. You can visit that map and look at data by year from 2016 to 2020 or by quarter. And over the last 4 years, every single province and territory has reported deaths by overdose. In 2016 and 2017, BC reported the highest number of deaths, followed by Ontario and Alberta. But in 2019, Ontario surpassed BC for the greatest number of total deaths in a given year. A report released in November jointly by the Ontario Drug Policy Research Network, the Office of the Chief Coroner of Ontario, Public Health Ontario, and the Centre on Drug Policy Evaluation reported a 38% increase in overdose deaths in the first 15 weeks of the pandemic as compared to the 15 weeks preceding the pandemic. If this rate continues, the authors project 2,271 deaths by the end of 2020 as a result of overdose, and this is in Ontario alone. This would be a 50% increase in the number of overdose deaths by 2019, from 2019, sorry. The same report notes an increase in overdose deaths during the pandemic where people are alone, where they are outdoors, or in hotel rooms. The authors note, and I quote, "These factors are all likely influenced by the pandemic-related changes aimed to promote physical distancing measures in the province of Ontario, which may have inadvertently reduced access to safer spaces to use drugs and to support networks, suggesting reduced opportunities to prevent these accidental deaths." The same report indicates that the overdose crisis has the greatest impact on people aged 25 to 44 who live in poor neighborhoods and among Black and Indigenous people. And on that last point, I would like to take a moment to acknowledge that our panel lacks a voice to represent the Black and Indigenous communities who are affected most by the overdose crisis. This was not an intentional omission. We did reach out to potential speakers from these communities, but we were not able to confirm someone for the discussion this evening. It was simply a question of logistics. Almost last, a quick word on terminology. You may have received an earlier promo for this discussion which talked about the opioid crisis. And you may or may not have noticed that in our most recent communications, we adjusted our language to talk about the overdose crisis. As our panelists will elaborate, there is a lot of stigma around the topic of tonight's conversation. This stigma is itself part of what we need to overcome to address the overdose crisis in Canada. Because drug use is normal. Indeed, Canadians are very big fans of two particular kinds of drugs, alcohol and cannabis. We have whole industries that promote the consumption of these drugs. Yet other drugs are not afforded that same normalcy. They are not legal, they are not regulated, and we don't have open conversations about consuming them safely. Our panelists will discuss the different ways that we stigmatize the use of drugs and how these factors contribute to perpetuate an overdose crisis in Canada. It's now my sincere pleasure to introduce our panelists. As I'm introducing them, if they've not already turned on their camera, I invite them to do so. And once I'm finished, I'll introduce them in the order in which they will speak, and then we'll immediately go to our first panelist, Garth Mullins. Garth is a drug user activist and award-winning radio documentarian. He is host and executive producer of the Crackdown podcast, where drug users cover the drug war as war correspondents. This is Garth's second overdose crisis. Garth used injection heroin for more than a decade and is now on methadone. He is a member of the Vancouver Area Network of Drug Users, a trade union organizer, and a musician. Roni Garrard is a harm reduction worker in Ottawa, a fourth-year Bachelor of Social Work student at Carleton University, and a member of the Canadian Students for Sensible Drug Policy. Roni draws from her lived experience engaging with recovery communities to demystify harm reduction in abstinence-based spaces. Jean-Sébastien Fallu is an associate professor in the School of Psychoeducation at the University of Montreal. He is editor-in-chief of a journal called Drogue, Santé et Société, and in 1997, he co-founded GRIP, G-R-I-P, a nonprofit organization that promotes harm reduction through education and awareness in party settings. Garth, over to you.
Hey, thanks very much, Rhonda. I'm in Vancouver today, right now, Coast Salish territory of the Musqueam, Squamish, and Tsleil-Waututh. I'm the host and executive producer of a podcast called Crackdown, and that is a sort of coverage of the drug war by drug users ourselves. We're reaching the end of our second year. I'm also part of a drug user union called the Vancouver Area Network of Drug Users that's been around for over 20 years. And I come to this work because that's my background. I've used opioids my whole adult life, mostly heroin and more recently methadone. But more, I have myself overdosed, and I have seen my community dismembered. Half the people that I've come up with are gone. And, when I'm around conversations about the overdose crisis, they haven't changed enough in the last 20 years since the last overdose crisis that I lived through. And that is that they're more polite now. So people were happy to say out loud extremely nasty things about people who use drugs before, and the debate's gotten a little politer. But the kind of systemic change that we need hasn't happened. And the other reason why I do this work is because, I live not very far away from where the drug war started in Canada and maybe North America. The first drug prohibition law was the Indian Act, and that prohibited alcohol from Indigenous people, or at least who the government considered were Indigenous people. And that was like the end of the 19th century. But in the early 20th century, here in Vancouver, there was a great wave of anti-immigrant fear and panic and organization. So like overt white supremacy was getting well organized by, the great and good of the city. And they had a rally in 1907 out front of City Hall. The rally turned into a riot. The riot went and smashed up Japantown and Chinatown. The federal government sent an ADM, an assistant deputy minister out here, or deputy minister of labor out here to look into, do business owners need to be compensated? And while doing this guy was Mackenzie King before he was PM. He did a report, and he found out that there was opium manufacturing taking place in the neighborhood, in the downtown east side. And he heard that this was a vector of terrible foreign influence on the white women and girls of Vancouver. And that's where the 1908 Opium Act came from, and that's when they first started cracking down. So around here in 1907, you would have smoked opium out of a pipe. And then when that becomes illegal, it's the same thing as alcohol becoming illegal. Everyone drinks beer, and then all of a sudden, everyone's got to drink harder stuff, moonshine, easier to smuggle around. And then people start getting sick and people start dying. So opium was the beer equivalent. But as soon as it became illegal and the police started arresting people, you had to chase around a smaller, the drug trade involved the police chasing around drug dealers, and the drug dealers, of course, wanted to get smaller and smaller amounts, the smaller volume, so that it was easier to transport around, and they became also more concentrated. People started using them through syringes instead of smoking. And then we had this arms race of more police action through the whole 20th century, stronger drugs, more police action, stronger drugs. They call it the iron law of prohibition. So when I was in my late teens, early 20s, we had something called China white heroin here in Vancouver, which was a publicly declared health emergency. They didn't give out syringes very much, so we also had the highest rates of HIV infection in the industrialized world. And drug users started to organize, and that's how we won access ultimately to syringes and ultimately to a safe injection site eventually. And we're still trying to fix this now. We're still trying to make the demands to clear the track now. But the drug prohibition, the drug war, is racist right to its very start. And it still hits Black, Indigenous, and people of color the hardest. And those statistics are most clearly shown by who gets harassed, who gets carded by the police, who gets arrested, and who dies. So whether it's in jails or in the morgue, those statistics are very blunt about the racism that's baked right into this. And so part of the reason why I'm here is because I live in Vancouver, and we have a sort of like a historic mandate to stop this massively brutal and bloody series of policies. So when people talk about it like it's kind of like a force of nature, I always say this is a force of policy. For most of COVID, we didn't know what the vaccine was. We know what the vaccine is for the overdose crisis. It's just pharmaceutical grade opioids. It's that just hoping that people will stop, do drugs. Well, people have had decades of all of that. It doesn't work. You have to replace what's killing people with what's safe. So thank you for inviting me, Rhonda, and thanks for having me.
Thanks, Garth. Roni, over to you.
Hi, everybody. Thanks, Garth. That was rad. I don't know how to follow up from that, but I will try my best. Yeah, my name is Roni Gerard. So I'm a harm reduction worker here in Ottawa at one of the 4 supervised consumption sites that we have in our city. I guess I am speaking to you in hopes that I'm able to translate some of the things that I've seen over the last however many months, it feels like 10 years, because our sites haven't shut down during the pandemic. We've been in PPE out there this whole time. I also am a little bit informed in my perspective as somebody who's in recovery. I have experience with substance use. I'm very connected to lots of folks who are in recovery communities in different aspects, and people who still use drugs are my people, and we're losing a lot of people right now, which is why it's really important that we're talking about this. It needs to not just be a conversation, however, it needs to be something that is bringing action. So my thoughts around COVID, just to start, I think a lot of us have been really focused on keeping ourselves and our families safe and okay, and kind of forget about other things that are happening, perhaps. I think, like COVID, I think the overdose crisis is preventable. I think that overdose deaths are preventable, just like COVID deaths are. If we enact the right public health interventions, people don't have to be dying. And that is what we need to be doing right now. And we haven't been, not adequately, definitely not in Ontario. For some context, in Ontario, at least, as you heard, our stats are the worst in the country right now for people who have passed away. We still have a cap on how many approved and funded consumption and treatment services or supervised consumption sites we can have in Ontario. Thank you, Doug Ford. So I think it was a cap of about 21 in our province. And things are being opened as, I think, urgent public health needs sites, which are not the same as a fully functioning CTS, which is what I work in at the moment. One of the sites in Ottawa actually lost provincial funding, which was the Ottawa Public Health site. Yeah, so it's clearly not a priority, people who use drugs in Ontario, at least. So just for some context, at my place of work, like I said, we have been in PPE. Our center has been in essential services mode since the beginning of the pandemic. So we had a cut in our hours of operation center-wide. So we used to be open from 8 to 8, and now we're open from 8 to 5, 7 days a week still, which is still a big chunk of time to not be giving services to people who need to be using their drugs, because people don't use drugs from 9 to 5. So in addition to our cut in services, we've also lost our drop-in services. So it's very transactional at the moment. People come in, they use their drugs, we monitor. If we need to intervene, we do so, and people are on their merry way. There's not a lot of space for interacting, not a lot of space for positive interventions with folks, following up, building nice relationships with people, making them feel safe, because it's very medicalized, which is the opposite of what we need to be doing. There's also a piece that I wanted to touch on really quickly. In this pandemic, there's been this like heroism associated with healthcare workers, and not all healthcare workers. Harm reduction workers and our nurses are very much healthcare workers, and we've been on the front lines this whole time and are not. And the peers who are doing the overdose response as well, especially are not given the same credit or appreciation or funds to support our work like other healthcare workers are, and that is extremely and entirely due to the population that we work with. It is due to the, I feel like not big enough to say stigma, the disregard for the lives of people who use drugs is what that is. We don't see people who use drugs as deserving of help or care or of having any sort of quality of life, because there's still this idea that drug use is a moral failure, which it's just a normal part of human existence. So we really need to be looking at changing our relationship to drugs as a country, especially as a city. Our city is just, anyway, I'll wrap it up really quick. We really need more sites in our province, in our country. We need, especially in Ontario, for Doug Ford to remove the cap on CTS services that can be provided. And we need to change our drug policies to match what we're actually trying to be doing, because we're just running around in circles trying to keep people alive and it's not working. We need to change our policies and decriminalize substances so we can keep our friends alive.
Thanks, Roni. Jean-Sébastien, à vous la parole.
Hi. Yes, well, first of all, I'd just like to mention I have multiple identities. I'm an academic. I'm from also community-based group, and I also like to present myself as a drug user, as we almost all are. First, when we think about the impact of the pandemic on the overdose crisis, I think it's an explosive cocktail or a perfect storm. It was already a very important and major public health crisis, which drawn not enough attention, probably because of many factors related to stigma and what Roni just mentioned, that the lives of drug users, thanks to years and decades of misinformation and propaganda and racism, apparently value less than other human beings. How did the COVID-19 pandemic impacted the overdose crisis? There's many ways. Garth talked about the supply side market, like closing borders really had an impact on the quality of drugs, access to drugs. Of course, the services, some of them were reduced or some of them closed. So we also seen more users appearing, people without jobs, people being stressed, people, and we know that stress, having no more work or any less social support is related to more substance use. The loneliness because of social distancing or physical distancing is something that can be from one side related to less human needs being fulfilled, so people can take drugs to fulfill this loneliness and deal with it, or even just trip because we don't have any more pleasures when we're locked down in our homes. It's a way to trip. There's also all sorts of distress related to contracting the virus for some. So many factors that we know are related to that are risk factors to take drugs, but also like for loneliness, we know that it's been mentioned in the Public Health Ontario report that more of them were alone, when the overdose was fatal, because maybe there was nobody to call or help or provide naloxone or something. So, and we know that was already the case, but that has been worsened with more people being alone. And we also saw that not only there was more users, but also more use, new modes of use, new places of use, more riskier. And so even like here in Montreal, I forgot to mention the unceded territory of either Mohawks or other First Nation groups. It's the jury's still out for what's in Montreal, but what's clear is the crisis, the number of overdoses in Montreal has doubled since the beginning of the pandemic. So we were quite, some experts said, public health experts said that Montreal has not really a crisis. It has no really a crisis here. But now I think nobody can say that. And I think it's the pandemic that's done that. And as maybe as closing remarks, I will make maybe some similar statements than did Garth around politics. It's really shocking that we know that for COVID, public health experts are listened by our governments, our elected officials, but for the crisis, the overdose, and all the problems related to that, they don't listen. We know there are solutions. Science is clear that there are better ways than strict prohibition. We have a lot of people, experts, calling for a change, but it's not happening for different reasons, as I mentioned, because of the stigma, because this human behavior, which is totally natural and always been existing and will always will, has been stigmatized, even if the risk-taking behavior of taking drugs is mainly driven by the policies themselves, and the risks are very often less than other human risk-taking behaviors. And we are really not consistent in assessing the risks and judging people who adopt some risk. And we even praise some risk-taking in our society, but just take alcohol, for example. And so it's really shocking. And I think when you look at policies around drug use and possession, one has to just see that it's just nonsense and it's totally absurd, and it's one of the worst public policy we've ever engineered, and this has to change. And I'll finish just saying that I'm quoting someone from the Global Commission on Drug Policy once said, penalizing drug use and possession is just plainly unfounded public policy, drug policy, public policy. So there's a lot to say, but I'll stop here and let's discuss around this.
Well, thank you to all the panelists for your remarks. There's lots there that I think we'll do our best to unpack in the time that we have. So I think it's interesting, you know, we started with some poll questions to the audience about who drinks alcohol and who has used or is using cannabis. And, you know, it looks like everyone in the room uses drugs of one kind or another. And so I guess, and you've all touched on this notion of a stigma. And I think, Roni, you said, you know, stigma is not a big enough word for the attitudes towards people who use opioids or other illegal drugs. And that could probably be a conversation all to itself. I'm just wondering, like, if earlier today, thinking about getting ready for this panel, I was thinking about how, you know, we have whole industries devoted to the promotion and sale and consumption of alcohol and cannabis and many products, and you can buy books telling you how to make your own and how to make delicious cocktails. And you know, what kind of interesting world we would live in if we could go to a fancy lounge and you could have your own cocktail of opioids, and it would be just as normal as picking up a drink from a bar.
Yeah, they used to have them, opium dens.
Yeah, exactly.
Yeah.
And yeah, so anyways, I thought that was an interesting idea that struck me, that we were that I think that the stigma here certainly seems to be a greater barrier than the cost or the political will, maybe a part thereof, to legalizing this. So actually, I think the first question is for you, Jean-Sébastien. Stephen asks, because I know your research area looks at decriminalization and or legalization of drugs, and he asked if you are aware of the experience in Portugal to decriminalize drugs.
Yes, thanks, of course. Yeah, Portugal has decriminalized all drugs since 2001. The evaluations are quite positive, but it's really complex to assess policies. There's a lot of confounding factors, but there seem to be like good trends in terms of less criminalization, overdoses, and HIV spreading and other diseases. But what I really don't like of that model is it's still very moralizing and stigmatizing. Drug use is portrayed as bad, and people who use them are also not good, citizens. And moving from a criminalizing model to a medicalizing and pathologizing model is not really an improvement. It's still social control. It's still stigmatizing. It's still not recognizing that the majority of substance users among the humans do not need treatment or punishment. And when you have to go through an assessment and being referred to treatment and services, in many cases it's not voluntary, it's mandatory. This is a form of punishment, and it's not recognizing that, as I mentioned, drug use is normal and it has to be normalized, like we did with other human behaviors. And I think the way we're moving forward with sex education is the same way we have to move for drug education and be drug positive. And I'm not saying we have to praise drug use, just normalize. It's a normal human behavior, and we have to deal with it the best way. And it's not by punishing or medicalizing this behavior that we're going to succeed. And in that sense, the Portugal model is maybe a step forward, but not more than that.
I'm wondering if you could just quickly differentiate, like, what's the difference between decriminalizing something versus legalizing something?
Well, the definitions, there's no consensus, but mainly decriminalizing is stopping criminalizing, but you can still punish people, ticketing them, or having them to force them into treatment. There's lots of possibilities, and legalizing is having a legal framework for either possession, production, distribution, use of defined quantities for ages. So that's mainly the difference.
Thank you. I think the next question is for you, Roni. I realize we're using a bit of perhaps health policy jargon. So Carl asked if you could elaborate, what do we mean when we say harm reduction? Does it mean treating drug use as a healthcare issue, or is it something more?
For sure. So to me, like the baseline definition when I say harm reduction is just acknowledging that people are going to use substances that may cause like some negative outcomes at some point in the context of where we live and the environment of how we treat people who use substances and where people get them and all these things. So harm reduction is about accepting that and acknowledging that and not putting any sort of moral judgment on that, and just strictly providing support and services that people require in order to do that in a more safe way, or as safe as possible, and giving people options to like make choices for their own bodies, their own drug use, you know, not deciding for people what they should be doing or how they should be living their lives. Yeah.
Great. And building, picking up on Jean-Sebastien's comment that we should be normalizing drug education the way we are in the same direction that we're taking with sex education. In the prep call we had for this panel, I think, Roni, you mentioned as a student in the social work program at Carleton, this is not a topic that your program covers at all. So perhaps on the education bent, I wonder if, you know, could you elaborate on what kind of education would you like to see added? For example, not taking a pot shot at Carleton, but because you're there, like, you know, as an example, what kind of training would you like to see as part of your degree, or is it available to nursing students but not to social work students?
Totally. Okay. So, all right. So yeah, I'm in my 4th year of my Bachelor of Social Work degree. I have not received any course material discussing, not even like the stigmatizing like phrase of addiction. Like I haven't been taught any of that. Even I learned like anything about substance use, I learned through my practicums that I was doing as a student, which means that I was put out into the field unaware of like anything to do with drug use, while working with people who use drugs, which I think personally is irresponsible. So I think what I would love to see and what we're pushing for with CSSDP Ottawa is the re-implementation of the Drugs and Society course that we used to have in our program, and potentially have that offered as an earlier, offered earlier in the degree rather than they're looking at doing it as a 3rd or a 4th year course. So we think that students should be learning about drugs, thinking about drug policy and prohibition, and learning about these things early on in their social work career, because the war on drugs impacts every single community you're going to work with as a social worker. And we need to be learning about these things, especially at Carleton when we are designated as Structural School of Social Work, which focuses on the macro structural systems that impact people. So yeah, that's what we're working on. And I think that in order to have a full conversation on oppression and systems that impact people and put them in marginal positions, we need to be addressing the war on drugs, absolutely.
Okay. Thanks for that. The next question I'm going to read out, and it's open to whoever would like to jump in first. It's from IOG colleague Stephen Van Dyne, who said, you know, the issues we're talking about this evening are most visible at the municipal level, our neighborhoods and our communities, but municipalities have the least amount of tools to address the issue. Provincial governments are responsible for health and the federal government for criminal law. Are there, I'm going to modify his question a little bit. Do you see places where the 3 levels of government are working together on this? And if not, where would you like to see them working together, or how?
I'll give it a shot if you like.
Yeah, please.
This is sort of a classic Canadian pastime, and policy analysts and wonks will know about the tendency for one level of government to point at the other level of government in Canada. And it's like we do it for everything, even COVID right now it happens in. And with drugs and criminalization of drug users, there's something every level of government can do. In Vancouver, the municipal government has just right now decided to ask the federal government to exempt the city from the Controlled Drugs and Substances Act using Section 56 of that act. So we'll see if that happens. When you run someplace like Insight, like a safe injection site, the Controlled Drugs and Substances Act is exempted in that building. So it means the police can't run up on people who are sitting down to inject drugs in a supervised way. They can't go catch those people in that building. So this is intended for health reasons or scientific study or safety, something like that. These exemptions can be granted. I don't think they've ever been thought of in a whole city, but there's no reason they can't do that. At the provincial level, all provinces have policing acts or agreements with the RCMP. Every level of government defines budgets for policing. So at the provincial level, the government can decide what they want police to focus on and what they don't, because police simply can't enforce every instance of every law at every moment. They all make decisions, and police forces themselves have the discretion. So if you ever hear a police chief saying, we're not going to arrest our way out of this, well, then tomorrow they should stop because they can. Police have the discretion, and senior police have told me this themselves. And then finally, of course, the federal government has the discretion, being the one who has the criminal code and the Controlled Drugs and Substances Act, and they are not interested. So what they all have in common, though they all have bits of this, is there's incredible cowardice across all these levels of government, and people having been presented with all the facts and unwilling to make these kind of moves. And that's on the criminalization side. On the side of just health, and I think the biggest health intervention is if someone's doing heroin, it's contaminated with fentanyl, they should be able to get diacetylmorphine from a pharmacy. That is prescription heroin. Before it was illegal, that's what it was. Let's just start using that again, because the number one health concern, and there are many, but the number one is being dead. Everything else you can't do after you're dead. So, and that's just a question of rules. The provincial government has some of those rules. The federal government has some of those rules. And if governments can't cooperate, this is a problem we've heard about forever. They can even look to history, where a generation ago, as late as 2004, there was something called the Vancouver Agreement, where the municipal, federal, and provincial governments were all working together. And one of the things that resulted in, or allowed anyway, was the first safe injection site. Of course, the Harper government came to power and started putting a wrecking ball to all of that stuff. But we have seen it. It is possible. So why doesn't it happen? All of the tools are there. This is where political will is. It is because drug users like me, we're not well enough organized, because I believe that history and society changes not because a benevolent government has finally seen enough reports and information and decides to take a political risk on something. It's when people organize themselves and force governments to change. It's why the vote was extended to groups of people who didn't used to have it. It's why the weekend exists, because of the labor movement. It's why environmental regulations, it's everything that's pretty much good in society came because people organized and forced leadership to, kick it down. So that's my part of it.
Yeah, I just want to pick up on two things you said, because I think that it's also, I agree with you. This is a Canadian pastime. It's also, I think, a quintessentially Canadian thing to wait for the government to do something. And we could be waiting forever. I just want to add, there's another movement that I think—
Luckily, drug users never wait. We've organized ourselves. So every reform that you see that we've talked about today, all the words come from the drug user movement. The words harm reduction, safe supply, decriminalization, those are all things we thought of. Safe injection sites, you see them everywhere. You have people on the panel that work at them. Well, we opened them first illegally, in Vancouver and in Toronto. Lots of places. I don't know if there's any country that has safe injection sites where they haven't been opened illegally first. So we never wait for the government to come and save us. We got to save ourselves. But at some point, we have to drag them along, or we're going to be in this legal gray zone forever.
Yeah, you're getting a lot of love in the chat, Garth.
Oh,
Jean-Sébastien, I think you want to jump in here.
Yeah, Garth almost said everything, but I just wanted to say that yes, the government can work together, but sometimes they just have different political views, and they throw the ball to each one another. But yeah, municipal government can do things too, like the city of Vancouver, and there's also the same initiative now I mean, the MP wants Montreal to ask for the same thing. But yeah, there's things to do at every level of the government.
Yeah. Okay. So maybe taking we've got a question from Allison, and she asks, to anyone in particular on the panel, what can we do, so as someone who's not on the front lines, what can we do to best support the people who use drugs in the context of the pandemic?
Treat them as humans, answer their needs, support them, don't stigmatize them.
Roni or Garth, do you want to weigh in on that one? I think Jean-Sebastien answered it really well, but I don't want to take that opportunity away from you.
All of what he just said, but also winter boots would be appreciated.
Okay.
Also, just all these amazing mutual aid groups that keep forming, especially in Ottawa. I don't know about everywhere else, but handing out like PPE to folks, and handing out Narcan to folks, and food especially, and like, again, yeah, winter clothes, that kind of stuff. Just showing up material stuff has been super beneficial during this pandemic, because a lot of services are cut down, right? And especially after hours, like when our site is closed, there's only one other site that's open after 5 in Ottawa, and they don't have the resources to meet the need of all the folks who need services and who need all these different things. So yeah, if people could show up, take care of each other, and give us stuff. We need winter boots for lots of people because it's super cold out. So that's my answer.
Okay.
Learn Naloxone. This is a really simple way you can save somebody's life. Anybody can do it. I've taught hundreds of people. You can learn in 5 minutes. You can learn online. You can get it anywhere. Every first aid kit in Canada should have this, because drug users aren't just out there somewhere in some street in some community. They are in your like workplace and church and community center and family. Like, we are legion. We are everywhere. And having that ability to use Naloxone, this is reverses an overdose. It'll work on like my partner's mom, was in the hospital recently, and she was taking hydromorphone, and she was wondering if she, her husband was wondering if she was taking too much. Well, I said, you have a Narcan kit. If you ever worry, just hit her with the Narcan, And so this is something at home you wouldn't think of this lovely 70-year-old, my wife's mom, being, your idea of a drug user, but it applies there too. So I learned that.
Well, and that's part of destigmatization, isn't it? That it could be anybody. We maybe don't want to admit, but we all probably think a drug user or an alcoholic or that each of these people look a certain way. Mm-hmm. There are a couple of questions here around defunding the police, but before we get to those, I want to ask you a question. We've talked at different degrees around the normalization of drug use, and there's a question here for you. Do all panelists agree on normalization as a goal? And would this mean treating all drugs as we treat alcohol, for example, distinguishing between use and abuse and providing support to people who abuse this, who use it too much, or who have a not normal use pattern, or not safe use pattern? Perhaps that's a less stigmatizing way to say it. I'm careful now that I'm not also asking you loaded questions. Stop me if I do that. In what way? There's a lot of questions here. I'm gonna wrap up the last two and then invite you to answer whichever portion you'd like. I.e. distinguishing between use and abuse and providing support to the people who have irregular use patterns, and in what way do current policies contribute to the dangers of drug use?
I think about these categories of drugs. I'm for normalizing human beings, first of all. Like, it is us that's criminalized, right? They don't put the drugs in jail. They'll take them off you and put them in the evidence locker, but I go to jail. I have arrest records in 3 countries. And I used heroin every day for a very long time, but it was also a rational move. Like, I was in a situation that I don't know if I would have made it through otherwise, you know. And it's sometimes self-medication. So sometimes I used it just rather than worst possible outcomes. And sometimes you also just want to get high and feel good. And so it's really hard to decide what kind of thing to normalize. I would say we should end discrimination based on those kind of behaviors. You know, that's maybe the flip side of normalize, and that comes down to the law. You know, it means that people who do certain things go to jail. You can also have decriminalization models where there's mandatory treatment. I'm against that too, because that's the same sort of thing. You got to like just let that health stream have lots of agency. And I think people need to access this stuff outside of the setting of a prescription pad. But and I also don't think that how alcohol is right now is like we shouldn't use that as a model necessarily either, or cannabis, because it's primarily like a way for big corporations to make a lot of bank off it, you know. And so maybe the private sector model isn't the greatest model, well, in my view, for a lot of things, but perhaps that as well.
Roni or Jean-Sébastien, do you want to weigh in?
Yes. Well, I mean, I think we have to normalize people, as said Garth, not just people who use drugs. We have a huge problem in our society where we exclude groups of people because they are fat, they are trans, they are polyamorous, or because they use drugs. I think we have to stop all of this. Of course, we need to normalize, and normalize is not condoning or it's just it's existing, and we have to recognize that it's not just individual, and it's not just like determined by individual factors. It's also socially determined. We live in a society that's producing addiction. We are always asked to work more, produce more in a capitalist world where we always search for more in a finite world. That's just insane. I mean, and starting from there, if people use drugs, they need support. They certainly don't need punishment, stigmatization. If they have problems, we have to recognize that it's not only their fault, it's also our policies, our world. And because of that, yes, of course, if people want help, support, health services, treatment, fine, but never mandatory, and always supporting them and not punishing them. And just add one thing. If we change our drug laws and maybe a little bit our society, there probably will have less very high potent and very risky drugs out there. People will use what we know, what humans have always used. You know, that's why we fear normalizing crack use, but I bet you that in another policy framework and in a better society, there would be a lot less of that kind of use and problem use, as we say.
Thank you. Roni.
Yeah, I just wanted to add like a tiny little piece, just kind of echoing what Garth was saying earlier. I think we have this idea that if someone is using substances for whatever reason, whatever kind of substance, it's this bad thing that needs to be rectified and needs to be changed. But I think we forget that people a lot of the time use different drugs to help them stay on this planet and, like, you know, stay alive. Like drugs have, certainly alcohol for me kept me functional